Seminar series with the Health Information Science program here at University of Victoria. Pleasure to introduce Karen and Brad. Karen and Brad are in Toronto. They work for Canada Health Infoway. Karen Jacquart has been with Canada Health Infoway since 2018, leading the innovation or innovative technologies initiatives that include artificial intelligence, AI, and continuous innovation framework. She has a background in applied sciences and industrial engineering at U of T, and also a master's of business admin in HEC Paris, and specializing in entrepreneurship. Brad Keates is a senior director at the Innovative Technologies team at Canada Health Infoway. He's leading projects and developing services and toolkits in AI, quantum computing, and identity management. He has a math degree, Bachelor of Math in Computer Science from University of Waterloo. They've been working with this AI implementation toolkit as a module to enhance the adoption of AI in healthcare. It was released earlier in November of 2021, just before the new year. They've also had a series of modules in their 6 modules in their documentation in this release that they've held seminars since January through March. A pleasure to have Karen and Brad presenting today.
Okay, thanks so much, Dylan. My name is, and thanks for everyone for attending, taking an hour out of your day. We hear exams are coming up. Also, we know the federal budget is about to drop, so thanks for choosing to spend your time with us. We hope we're more interesting than the federal budget announcements. So my name is Karen, and together with my colleague Brad, we'll be presenting on the Toolkit for Implementers of Artificial Intelligence in Healthcare. For those of you who are unfamiliar with Canada Health Infoway, we're a federally funded not-for-profit health agency. We're one of a handful of pan-Canadian health organizations, PCHO, you may have heard of that term before. And our focus, our organization's focus is furthering the digital health agenda in Canada for Canadians. One function of our organization is to convene various stakeholders on different topics. So for example, on topics such as privacy, security, interoperability, and now we're bringing AI into the mix, and that helps us further the digital health agenda along. About 1.5 years ago, the Innovative Technologies team was formed. We have a very small team. Our mission is to accelerate the adoption of innovative technologies in health settings. We know this is a big problem in Canada, not just for AI, but all technology. The healthcare system in Canada is a laggard in adoption. We know banking is ahead. We know consumer products are ahead. Healthcare is always behind. And again, it's not just about AI, it's really about all technologies. So that's one of our missions, is really to help accelerate the adoption of innovative technologies. And one area where we placed a lot of focus this year was on AI, and that's what we'll be talking about today. Okay, so for today's session and for objectives, first, I'm going to give a bit of context on AI in Canada and healthcare, and really to give you an understanding of why we developed this toolkit and for this specific audience. Second, and I'll hand it over to Brad for this part of the presentation, we're going to give an overview of the toolkit. It's 6 modules long with a comprehensive set of appendices. We're going to also talk a little bit about who it's for and who it's not necessarily for. If we've accomplished 1 and 2, then hopefully we'll spark your interest enough to go download the toolkit. And if you're in a position to do so, actually use the contents of the toolkit. And fourth, and this is something we haven't yet presented in a forum like this yet, is the results of Infoway's annual tracking survey. So Infoway historically has issued a citizen tracking survey. So what that means is we survey about 12,000 Canadians every year on different topics, basically, around digital health, their attitudes towards digital health, adoption patterns with digital health. Last year, we were able to incorporate some questions about innovative technologies as well as AI, and we have those results also for you today. So I'm going to begin with a bit of context. As I mentioned, the Innovative Technologies team was formed about a year and a half ago. AI quickly became an area of focus for ourselves. The minute you start to research AI in Canada, I'm sure you guys all know this already, you realize Canada has a very rich history in the space. And Canada is really a global leader in acquiring and training AI talent. So as a nation, Canada really began making an impact on AI research early in the 1980s. Since that time, and even earlier, AI as a technology area has experienced its fair share of hype. So moments of, a lot of investment, a lot of interest, a lot of research, also troughs. And these are known as AI winters, where essentially excitement chills. There's investment pulls back, researchers pull back. There's really no fruit to the labor that was driven by all the excitement. And so with that in mind, understanding there are, basically the hype cycle really applies to AI, you might be thinking to yourself, okay, why AI, why healthcare, why now? You guys might be not, we know you guys are super knowledgeable people in this space, but just not to take for granted that it hasn't always been this way. And we think really that this latest round of AI excitement, particularly the last 5 years or so, has really been propelled by advancements in computing capabilities and broader access to these capabilities. So think of cloud computing and SaaS models, which really gives a lot of people access to the compute power that you need, as well as the vast amount of digital data that have been accumulating in healthcare. And so that feels like a given right now, but 15 or 20 years ago, that wasn't the case. And it's really because over the last 15 or 20 years, we've really been adopting EMRs, PACS solutions, EHRs, and other electronic data collection tools in the health setting. So that really gives us the wealth of data that we need to be able to develop AI solutions. So back to the Canadian story, in 2017, Canada was really the first country globally to develop an AI national strategy. So not a health strategy, but an AI national strategy. CFAR, an organization stands for Canadian Institute for Advanced Research, was funded $125 million from ISAID to develop the strategy with some key programs. And the cornerstone program of Canada's strategy is really about developing and retaining talent. And so they developed this research chairs program, and that's affiliated with the 3 big research institutes across the country. So the Vector Institute here in Toronto, I'm phoning in from Toronto, Mila in Montreal, and Amy in Edmonton. And so this is a huge investment in talent, research, and development. So we know Canada has the talent. And as it turns out, 30% of these research chairs have some affiliation to healthcare. And that's going to take me to my next slide, where I talk about not just about AI in Canada, but AI in healthcare in Canada. And so it was really because of this high interest in healthcare from those researchers that in 2019, CFAR, so the Canadian Institute for Advanced Research, put together an AI for Health task force. So these were roundtable discussions from prominent people from across the country to identify what are the opportunities for AI to make an impact in healthcare, and also what are the challenges for AI in healthcare in Canada. And they identified 3 main application areas for potential uses of AI. That includes healthcare delivery, disease prevention and public health, and discovery and development of diagnostics. Of course, they also identified the challenges that we face in this nation. And originally I'd said, it's really hard to adopt technologies in Canada. That is also true for AI. And so a couple of the key challenges they talked about specifically with AI. One is AI data infrastructure. And this is probably, I'm preaching to the choir on this one. It's very difficult to get health data to develop the algorithms. There was a call to action for a national AI health strategy in Canada, and they also called out the need for accelerated development and deployment of applications. And that's really quite important to Infoway. One thing I don't have on the slide, I highly recommend if you don't know about this report, you can find it on the CFAR website. Super interesting, it's about 25 pages, super accessible, still relevant today. It was published in 2020, still relevant today. So we read this report. We also started speaking with other organizations in the AI space. The Royal College of Physicians, for example, who also published a report called AI and Emerging Digital Technologies report. And we started to get an idea of the landscape in Canada. We recognized first and foremost, it's a really busy space. So we have those world-class research institutes, not just the ones I mentioned, but the universities across the country doing a lot of work in developing talent and developing really the core research that these AI applications are based on. Our startup community is thriving. Federal and local governments are investing in infrastructure platforms to varying degrees of success. There's the DHDP project, which is implementing federated learning solution across the country. So that's just in its early days right now. And additionally, we know some hospitals are doing leading work in this space. So not only deploying AI solutions, but also developing AI solutions. So all of that, taking all of that into account, the gap that we really honed in on was that of taking AI from an idea to implementations for healthcare delivery organizations, so hospitals, clinics, long-term care homes that don't necessarily have the resources or experience to do it on their own. So the larger hospitals typically do have those budgets and do have those expertise, and they're located near those AI research institutes. But for a majority of Canadians, or for at least many, many Canadians, they don't live in the big city centers, and it's harder to get access to that same level of technology. And so that's what we're really focused on, is targeting smaller to medium-sized hospitals who don't necessarily have the access to the same resources that the large hospitals do. I'm going to move on here. Okay, so I talked about AI and all the potential and all the hype without calling it hype, let's say. I do want to spend time talking about actual implementations in Canada and to really talk about how is AI improving healthcare outcomes for Canadians today. And hopefully this is evidence to support the fact that this isn't just hype. Of course, only time will tell, though. We can never be sure. The first point I'd like to make here, and that's really kind of talking to the right-hand side of the screen here, is that there are multiple different kinds of AI applications. So from clinical applications that directly impact patient care, research and development, Canada has many actual drug discovery companies. It's a big thing here. It's very interesting. Administrative applications, also super interesting, leading to cost avoidance for administration of healthcare delivery organizations, as well as for detection and diagnosis, and that really kind of falls under clinical applications as well. Why it's important to understand that there's different kind of classifications is it leads to different level of risk that you're introducing to the organization, and you then take on different mitigation strategies. And those are the types of things that we cover in the toolkit. And as I said, Brad's going to be talking about the toolkit and the contents of the toolkit in the second half of the presentation. On the right-hand side of the slide here, you'll see some actual use cases, and these are all taken from the toolkit. We'll provide a link to how you can download the toolkit later on in the presentation. But in Providence Healthcare in BC, they implemented technology to detect the proper wearing of PPE to mitigate the spread of COVID-19. At UHN Princess Margaret Hospital, so leading cancer hospital in the country, they began using AI algorithms to develop radiation treatment plans for their patients. And not only do they deploy the solution, they also help develop the solution. So this is an example of one of those big hospitals with the resources available, not only to deploy the solution, but also to develop the solution. The CHUM in Montreal, they're using a Canadian developed AI solution to predict hospitalizations and patient demand for supplies, which helps them optimize their supply chain. So that's really an administrative application and leads to reduced costs. And the fourth application I find actually quite interesting at Toronto, again, we're talking about a big city center here, Toronto, Humber River. They implemented a robot called Pepper that helps patients wayfind. And what that really means is help patients find their way through the hospital. I used to work at UHN years back. It was big topic there. When the patient gets to the hospital, they don't know where to go. So this is an example of a robot, not in a clinical application, still interacting with patients, but just helping with the administration of the hospital. These are examples of AI solutions used today, really helping build the evidence to further adopt AI solutions within the healthcare setting. Going to move on. Okay, but is AI all good? I think we all know the answer here. No, and we've seen a lot in the news here, just a couple clippings on the right-hand side of the screen here. AI travels with a lot of new risks, a lot of new considerations. They can produce biased results, for example, if the training data is not representative of the population that the AI will serve, and this can lead to harmful consequences. So things that we didn't have to think about in the world of digital health before AI, we have to start thinking about now. So for example, as organizations started implementing EMRs and other digital health tools, 15, 20 years ago, we weren't talking about things like biases. We weren't talking about explainability. We weren't really talking about unintended consequences of these solutions. We were thinking about, privacy and security of health information, downtimes, software bugs, things of that nature. Now, as we begin down this path of introducing AI-enabled technologies to the healthcare system, we can't not plan for these new risks and considerations if we want to mitigate the harmful consequences that AI can cause. And this is really the key coverage area for the toolkit. So what are the net new or the delta considerations that implementers in hospital settings have to think about as they begin their AI journey? I tried to talk a little bit about AI in Canada in healthcare, specifically real impacts that it's having on the health outcomes for Canadians. Also, we talk about the risks. This really leads us to the toolkit. We worked with Carol Poivison. I mentioned earlier the AI for Health task force. Carol was part of that task force. She is a managing partner at a law firm in Toronto called Inc. Law. It's a leading law firm, also data consultancy with deep expertise in AI risk management. And so we worked with her and her team to really develop this toolkit. One question who we really tried to answer was, how do we move, if I am the CIO of a hospital, from the idea of implementing an AI solution to actually implementing that AI solution, one, faster and with less resources, but in a way that doesn't compromise the trust that Canadians have for our healthcare system. So thinking about all those risks and considerations that I'd mentioned on the previous slide. So we landed on a 6-part series targeted, again, at smaller to medium-sized hospitals and other healthcare delivery organizations. On the next slide, I'll talk really specifically about the audience we're targeting. And generally, we provide both policy discussion and operational guidance for responsible AI innovation, with the ultimate goal really to improve health outcomes for Canadians. This slide, we take a lot of time to talk about the audience because we were having a quick discussion before people joined the webinar. AI is a very big space. People have preconceived notions of what they think AI means. It means something different to everyone. We really tried to fill in a small gap in the landscape, and I told the story of how we got to filling in that gap. And this slide tries to also kind of articulate that a little bit more. So on the right-hand side, you'll see healthcare delivery. These are organizations focused on healthcare outcomes. So these are hospitals, clinics, primary care clinics as well. On the bottom row, you'll see just beginning. So these are people who don't have experience or have very little experience in implementing AI, because we really talk about some of these rudimentary risks that you have to start thinking about. The farther you get from this kind of what we call our sweet spot, maybe the less useful the toolkit will become for you. So on the left row there, you see research and investigation. That's really, we're kind of referring to the research institutes, a lot of the universities who are doing the core AI research. This guide is not really possibly going to help you. It's not talking about data. We do touch a little bit on data, but it's not a toolkit for people developing AI solutions. It's a toolkit for people implementing AI solutions. And furthermore, we get into even more detail. The toolkit itself is about 90 pages. We know it's a lot. Not everyone has the time to read 90 pages. So again, and we include this in the toolkit, really trying to direct different roles within the hospital to the modules that are going to be of interest to them. On the top row, you'll see we've listed out all the modules. And on the first column, you'll see these are the roles we think people will be interested in. And we try to really direct people to the content that we think will be useful to them. And so right now I'm going to transition over to Brad, and he's going to take us through the contents of the toolkit. Brad?
I'm muted there. If you guys hadn't had a muted Zoom today, you've just had your first one. Karen's going to run the slides for me today, I think, just to keep it simple. So thank you in advance. So 6 modules, lots of appendices, and this is for a very specific audience. You know, AI implementers. We didn't really know what to expect with this type of toolkit as we made it available. But we're at a stage now where we've had somewhere north, like more than 2,000 downloads of the toolkit and lots of feedback. And I feel like we've tapped into something. And I think part of what we're tapping into is this general challenge Canada has with innovation in healthcare. And I'm not sure how many of you are students of the challenge here, but there's been lots of work done in this space. If you haven't read the Naylor report from 2015, it covers it chapter and verse, 150 pages of it on challenges in innovation. There was a more recent report from the Canadian Medical Association in 2019 about how do we get more innovation in the space. And there's lots of reasons why Canadian healthcare system has been challenged with innovation, and some of it is about capacity, and some of it is about funding, and some of it is about the way healthcare is structured in these very loose federations around the country. But a big part of it is about the risk and the way of looking at the unknowns. And in this first module, when we talk about the introduction to AI in healthcare, we try to get right down to like, why now? What does it make sense? And Karen hit these points there. There's more computing power available. There's a lot of energy around doing something new because of the pandemic. There's a sense that there's some sort of large set of data sets out there to drive these algorithms, although in practicality, there are small sets of data algorithms to drive them, and we'd like to figure out how to get more. And even with all this funding that the federal government's done, that CFAR's done, that startups have done, there's still a big gap between the innovation that's absolutely happening and the implementation of the innovation in healthcare. And hospitals, long-term care centers, clinics, they're taking a wait and see attitude, you know, and they just need to continue to focus on the quadruple or triple aim about better care and population health and how do we drive it down. This first module really covers this space about what's going on, what does it look like, where are some of the choice points as we're going along. The other thing about this slide is we've tried to look at each module, and Karen targeted some of this to say what's in the module. You know, if you figure you've got a handle on introduction to AI in healthcare in Canada, what the challenges are, maybe this isn't the module for you. I'm just going to reinforce it off the top. So this is the first module. It actually was, when we ran a webinar, it was the one that had the greatest attendance associated with that. Read into that what you want, but it was very attractive. When we did a survey of people who were attending the webinars that supported the toolkit, in general, about half of the people who attended had not yet begun to tackle AI in their hospital or healthcare setting. Just the audience that we were after. How do you get ready to make it happen? So I think that's one of the reasons why this was a popular topic. The second module, please, Karen. Thanks. Now, Karen touched at the high level on what the key risks of AI in healthcare are. And I bet this audience is very capable of having a discussion about bias and privacy and things like that. What we're doing in general with these modules is we're trying to provide an approach to tackling things like algorithmic bias, the associated challenges related to data bias, the reinforced, that causes reinforcement of existing inequities. But what do you do about it? What are the 5 steps? What are the 10 steps that you might want to take to begin to dig in a little bit deeper to the algorithm, to dig in deeper to the data, to make sure that's going to be a fit for what you need to do? One of the use cases we always had in mind was on the explainability part, was when a healthcare professional, a doctor, a nurse practitioner was sitting down with their patients, explaining what a course of treatment might be. And at some point they mentioned in the AI system recommended X and Y and Z. How do we inform the healthcare professional? How do we give them enough information to explain how the algorithm made these decisions and be able to have a conversation as you're moving along? Again, it's one thing to say that conversation needs to happen. It's a different thing to say, how do you go about having that conversation? The whole topic of unintended consequences and do no harm is a big one. You fix one problem and you create 3 others. Like, how do you think about what the trickle down and what that looks like? And I think the major point that we want to get here is not that this module is about identifying things that could go wrong. It's about, what do you do about it? How do you give tools to groups that are beginning to move forward to take away some of the barriers that they may see when they're implementing it? In Ontario here, we have this model in our head of a mid-sized hospital in a mid-sized city. Karen and I talk about Stratford General. To be honest, I don't actually know if there's a Stratford General, but somebody who wants to implement AI, how do they go about doing it? And how do they begin to just pick off the questions and the concerns that are going along? That's what this particular module is about. Next module, Karen. Now, 13 provinces and territories, regulations galore. Every province has privacy regulations for the private sector. It's got regulations for the public sector, and many provinces have regulations for healthcare. So you've got almost 13 times 3. You've almost got 40 sets of regulations to look at. What we do here is we map each one of those types of regulations as they exist now, and it's definitely a moving target, onto things like, what's the approach that a public sector, citizen-based data view would have for automated decision-making systems? And what is the approach from a private sector view about how automated decision-making systems might work? Same type of thing for explainability, for notice of what's going on, and de-identification of data. Now, if you grew up in BC, if you go to school in BC, if you end up getting a job in BC, maybe you only have to deal with 2 or 3 versions of it, except for the fact, I'd say, that these are constantly moving targets. The regulations don't keep up with what the technology looks like. A lot of these approaches are going to help you with that as you move along. Again, it's about checklists and what it looks like. Really, I think, really nice set of comprehensive, not just listing of the regulations and the privacy approaches for each province and territory, but from a lot of different angles as they're moving along. This tends to be an area that everyone is interested in, but maybe doesn't have their hands tightly wrapped around unless they're actually specifically engaged in privacy. And for good or for bad, this is something we all need to be a little bit closer to and understand as we're moving along. Next module, Karen. So this topic of strategic opportunities and investments in AI, where it starts is an approach to looking at an assessment of your organization. So if you're in a hospital setting, there's an ambulance running by me right now. I've done that for a fact. I've planned it. So this would happen. If you're in a hospital setting and you want to implement an AI solution, what we're recommending, one moment. There, gone. Downtown Toronto. That's what we get all the time. If you're in a hospital setting and you're thinking about implementing AI, how do you go about evaluating the state or the nature of your institution? Is it a very technology forward innovation organization? Is it an early adopter? You know, a group that's constantly monitoring what's going on from an innovation perspective and is ready to go for the right type of opportunity? Is it an organization that's the word we're using is majority adopter for proven solutions? You're ready to go, or is it an organization that's really a late adopter, maybe never going to get around to it? So first of all, evaluate where you are, and then that leads you down a series of other paths about if you think there's an opportunity, how do you look at your data ambitions? Like, do you actually have a single patient record? Do you have access to that particular information? If you're implementing a solution from a supplier, a service provider, does the data that solution travel with, does it fit the demographics of your patients as you're moving along? Or are you going to have to do a lot more additional work to go find that data and what that looks like? How do you get your I call it the overall team engaged? What type of training do you have to do? How do you make sure that you move ahead? This is the beginning of a conversation, not just about analyzing strategic opportunities, but really, I'm not going to move to the next module yet, but just in a second, but how do you think about the magnitude of what you have to do from a change management perspective? And it could be that what you decide is the best thing to do is start with a non-clinical or research application. Maybe it's an administrative application. An employee chatbot would be an example we've seen a few times. That way you gain a little experience. If you do make one or two small mistakes, it's not a serious patient level mistake. You can move ahead, you can understand what that looks like. And you know, when you begin to target even more complex situations, more impactful situations, you're a little bit more informed. So a really interesting module here. The next module that we've called module 5 because it comes after module 4 and is before module 6, change management for AI adoption. Most hospitals likely have a pretty good set of change management policies and procedures as they move through. And we'd want to just kind of build on that. So it's everything from getting, you know, in an initial case, it might involve getting people from the board of directors or maybe a subcommittee from the board of directors involved. Likely would involve a series of people that have the word chief in their title to make sure that they're comfortable with it. What do you do from a training and communications perspective? A really important topic that comes up a lot is this whole concept of the spectrum of AI interventions. So everything from using an AI algorithm in a healthcare setting to give a healthcare professional or a team of people a set of choices to something that's totally automated where the AI algorithm makes the bulk or all of the decisions. But there's a half a dozen sets of spectrums there, and that can begin to set people at ease. It doesn't have to be that last part. It can just be a wing person going through a wings algorithm to help people make decisions. And I'm guessing that's where a lot of people end up right now. But that can mitigate a lot of the, call it the early angst that goes through these types of decisions. We say, you know, we don't have to implement like a completely automated decision-making process as we go through this. I think the other thing that shows up kind of unexpectedly is this idea of robustness. You have an algorithm, you have good data, it's making good decisions, and then something changes. Maybe the data changes a little bit. The algorithm behaves unpredictably for reasons you can't put your finger on. And I think digging into that a little bit early on, there's a series of checklists again that we begin to look at there as we move through this. We don't, you know, as Karen mentioned, we're trying to build on the policies and the processes that are already in place at a hospital, long-term care, or clinic. The privacy assessment in place, we'd want to add to it, not change it. The risk profile and the risk approach, we want to add to whatever the organization's using and add to it. Same thing from a security perspective. How do we just take and build on what's already in place? And I think that leads into this final topic on module 6. I like this one the best. You know, I think some people think it's the most boring part. of anything that's going on. How do you manage these things? As it turns out, there's so many disciplines that are involved in an AI solution. It really does touch on multiple groups and multiple departments. It can come across as high risk. We're trying to de-risk it. We're trying to give tools, approaches, checklists, advice, experience to say, here's how you can begin to look at it as we're moving through it. I think it's the module that's got the most meat around it in an area that's still fairly early in the development cycle from an implementation perspective. So this is these modules 1, 2, 3, 4, 5, 6. This is the meat and potatoes of how to address some of the challenges, real and perceived, about implementing a new solution in general, but in particular from an AI perspective. Again, as I've said, it's been pretty well received from a download perspective. We get really good feedback on it, and the only type of negative feedback we get is they'd like that, that little matrix that Karen had that has some green in the bottom right-hand corner and some red in the top left corner. People want us to move up into this top left-hand corner, more into the software development and research area. We're not ready to do that. We're likely not even the right group to do that. But it's an example of some practical things that we can do to address this whole conversation about how do we get more innovative solutions that address fundamental healthcare outcomes like patient health or like population health or cost of delivery. How can we put some meat on the bone of how to move that forward? And the pickup has been really, really nice so far. We consider that we're in early days and we have a lot of things going on. Next slide. This is how you can download the toolkit. It's available as one big module or six separate modules, and then actually another download for the appendices, which are a critical part of it. I got a bad habit of skipping to the appendices and the annexes of documents to begin with, because I believe that's where it always is. That might be reflected in this. It's available in French and English. We did do a set of webinars that help a little bit more in February and March. Those are all available for viewing. If you need to get in touch with us, you can send an email here at this address or at other addresses that Karen and I have a little bit later. And there's a QR code, and I think the slides will be available at least in a YouTube in the next day or two if you need to get this. And I also noticed that Dylan had put the download in the chat link as well. So no excuse for not knowing where to download this thing. Let me just say this about that. Next slide. I wanted to just do a transition, and this is a slight bit of a build, but just talking about AI. Infoway's annual digital health survey of Canadians. We've been running this for almost a decade, and initially it was about how did Canadians interact with the digital health tools and systems that were moving along. And it's a panel of 12,000 citizens. There's lots of longitudinal information, year to year. What do the changes look like? It's about digital health. It's got this representation across the country by province. It's got pretty good demographic information by age. This year, we put a lot of time into developing an Indigenous viewpoint as well. So we got a much better sample this year than we have in previous years. And the reason why we're talking about this today, for the first year, Karen was able to get a lot of good AI questions in here that I think really got to the heart of it. And I was able to squeeze in 1 or 2 questions as well on innovation. There's the link for this survey. If you're into data and what Canadians are thinking, this is right up your alley. It's a good reference point. Partly because it's been done consistently, partly because of this longitudinal aspect to it. And it's something we're really, really proud of. And it forms a lot of our decision-making as we move along. It's chock-a-block full of information. Next slide. So let me just say that this is a question about innovation in healthcare and Canadians. And we asked this group, this 12,000 Canadians, split by geography and by demographics, their perspectives on how important innovation and an innovation technology plan were in their healthcare provider organization, what that would look like compared to other countries. This kind of is this an area that the kind of on the broad level from a federal or provincial level that we should be investing in, and how does healthcare compare to other industries? And let me just summarize this by saying, 75, 80% of Canadians think it's either very important or moderately important that technology and healthcare combine, and they want to see it happen. And, we know from our experience, we're both part of the healthcare system, but we're also patients ourselves, our family are patients, our parents are patients, our brothers and sisters and friends are patients, that there's a lot of variability in just how well technology's picked up here. By the way, BC's got a fantastic reputation across the country in terms of leading edge digital health implementations, but I bet there's lots of people, in University of Victoria right now on this call who are not satisfied where you are, but you're actually doing a great job relative to every other province. Don't repeat that to any other province, by the way, but you heard it here from me. You're doing a really nice job. To go to the next slide, there's 3 or 4 slides on AI. And the first part here is knowledge of artificial intelligence on a scale of 1 to 4, with 1 being not at all knowledgeable and 4 being very knowledgeable. 50% of Canadians say they are very or somewhat knowledgeable about AI. Now, this is not a question about healthcare. That's going to come up in a second. This is a question just in general about AI. And whether Canadians are very knowledgeable about AI or not isn't really the point. The point is they think they know a lot about it. It's a topic that they believe they're familiar in. They've done the level of research that they think is appropriate. That's a pretty impressive starting point for a conversation about AI. On the next slide, though, we ask a question that's much more specific to healthcare on a scale of 1 to 4, with 1 being very uncomfortable and 4 being very comfortable. AI has a lot of potential use in healthcare because it can rapidly process vast amounts of information. How comfortable are you with AI being used as a tool in healthcare? 60% of Canadians are very comfortable or somewhat comfortable about this. And it varies a little bit by geography, and it varies a little bit by age. But it's a pretty good starting point for a new technology that's just starting out. And I'll just move to this next slide here, and we're kind of whipping through this a little quickly right now. Here's really the punchline for a lot of this AI work, and it's about not AI and algorithms. It's about the data, our data, their data, and how it's used. How comfortable are you with scientists using personal health data for AI research the first question is, as long as informed consent has been provided by the patient? This is almost 70% of Canadians say that they're comfortable or very comfortable with this. And even more interesting in my mind is almost 50%, almost half of Canadians say even without informed consent, as long as it's anonymous, Canadians are very comfortable or somewhat comfortable with this. And what I would offer to you, and it's a good topic for conversation, and we can have a 5 or 10 minute conversation about it, because that's how much time we have, where we can, one day, if Karen or I in Victoria, we can have a 2-hour conversation about it. I would argue that Canadians' discomfort with the use of data and AI is not one of the fundamental issues that we need to look at. Now, Dylan, did you have a question, or you're giving a thumbs up there? Or it looks like maybe you're pushing a trigger as well. Hard to tell.
It's all good. I have questions, but just keep on going.
Anyway, so I'd say this is part of it. What Karen and I are addressing in the toolkit is something else about governance. This is about the healthcare delivery groups, the hospitals, long-term care groups, the clinics that are out there. How do we take some of the concerns they have and give them an approach to kind of picking them off one by one as we're moving along? And I think, Karen, there's 1 or 2 more slides. Oh, yeah. And then there's this final one. So for the people who are concerned, what are you concerned about? The top 3 concerns. And I just want to pick off the 2 here: loss of human interaction with healthcare professionals and privacy breaches. And, when we looked at this, we realized we might have asked the question in a different way, because my guess, and we're going to figure this out next year, or actually next year is this year, is that this loss of human interaction and privacy breaches, this is at least in some part about general use of digital health technologies and citizens, patients being disintermediated from the healthcare professional, not specifically about AI. But again, what this does is it just gives you a list of things to think of. What is actually the most important? Look at that: perpetuating inequalities in healthcare. If we can get a handle on algorithmic bias and data bias, because that gets a lot of attention, to, average citizen. If we can improve that, how do we turn 22 to 18 and how do we turn 18 to 10? That's something we have approaches for. We can begin to make some progress on it. And we're all part of making that, making that real, I guess, as we move along. Next slide.
Are
we finished? Yeah. Okay, so like I think there's a lot of good news in that data part there. I think Canadians want us to be innovative. They're open to using AI if we manage it properly, and of course we could mess it up if we didn't look at it. But that's not what we're going to do. Obviously, some things are a little new, a little different. We can begin to approach that. And we can take advantage of these billions of dollars that are being spent on research, on talent, and we can work at translating them into the healthcare outcomes that are likely the most important thing for Canadians, above and beyond, the economic benefits of research in AI, the GDP, the jobs that begin to show up, and where Canada sits on a pecking order of AI focused countries that are out there. I'm not saying that's not important. I want to say that's important, and how do we take that investment and turn it into healthcare outcomes? And this is our little part of the puzzle as we move along. And we got a few minutes left for questions, and Dylan had one at least to get going, I think. So thanks, everybody.